Advanced Health Assessment of Adults includes many assignments with the ShadowHealth platform. This platform has assignments within it that are of varying value and weights in the course determination of the course grade, and they have different purposes. So I want to draw your attention to each of the 5 types of assignments in ShadowHealth and help you understand some of the overview and differences between these different assignments. First, you're going to complete an orientation. Pretty self-explanatory, gives you practice using and navigating the platform. Then there are 3 different concept labs within the course which help you learn how to use the virtual health assessment equipment and tools and practice with those related to various body systems. And you can do this again and again. There's not a score, but it basically orients you to specific health assessment instruments. Then the bulk of your assignments in ShadowHealth are going to be system-by-system exams. They each have multiple attempts with them, so you can, if you're not satisfied with how you do the first time through, you can do the assignment again. You can pause and return to these assignments where you left off. And you know, generally, students will find this work quite challenging. These are where you'll begin developing the techniques and your work with Tina Jones throughout the semester. And so I just want to make you aware that you can stop and go and restart with these assignments. And some of the important things to me about them are the way you answer the questions at the end of the assessment and work with Tina, and we'll talk some more about that. Then there are focus exams. There's 3 of these focus exams. These you cannot start and stop. You just have 1 attempt with them, and they are considered summative. So the language we use in education are formative and summative types of assignments. System-by-system exams are formative, where you'll learn a lot. You'll probably make a lot of errors in them. You'll try again. You'll get better at it. And then the focused exam, you are really presented with a new client. There's several different clients you'll work with, and you will use your assessment work and the learning that you've done with the system-by-system exams to perform a focused exam and determine what the patient's problem is and identify and write that up. Finally, there's a comprehensive exam. Health assessments come in different forms. You as an RN are most accustomed to doing a system-by-system or more of a focused exam. The comprehensive exam is organized not by body system, but instead it is organized by the body itself. So you start in one region of the body and you assess everything you can in that physical location. Then you move to another region of the body and you assess multiple body systems in that region. You move to another region of the body and assess systems. So part of doing a comprehensive exam is organizing yourself so that you don't ask the patient or you yourself to move around too much. So there's an assignment within the comprehensive exam where you have to decide what the sequence you're going to perform the various activities in, and then you will perform it in that sequence. So those are the types of ShadowHealth assignments that you will be completing. I have an expectation for you that you have very strong introductions and conclusions in your ShadowHealth assignments. In the introduction, I expect that you introduce yourself as an advanced practice RN with each visit, and that you include a brief explanation of what you're about to do together with that client. So for me, it would look like, hello, Mr. Jones, my name is Dana Brackney. I'm an advanced practice RN in diabetes. I wondered what you would like to accomplish today in the visit. And I listen to what the patient would like to do. And then I usually say, well, what I would like to do is ask you some questions. It will help me determine what the next best treatment will be for your problem we'll work together, and this will take about 20 minutes. Does that sound okay with you? And so you see that's an introduction, and each person determines their own introduction. It's kind of your nursing swag, but I want you to work to have those components where you say basically your credential, who you are. You ask the client what their concern is, why they are there. That's their chief complaint. And then you explain to the client what you will be doing with that visit. I expect you to incorporate brief education or motivational interviewing with your system-by-system exams. Brief education has to do with, for example, if you uncover that someone is not taking their medication correctly, you might briefly educate them about the correct way to take the medication. On the other hand, if you discover that someone is smoking, then that's a behavior, and you would use motivational interviewing to explore the person's quit history. How many times have you attempted to quit? What seemed to work well for you? Would you like to continue smoking, or what would be the benefits to you if you quit? These kinds of questions are briefly done in the context of the health exam. I expect you to display empathy in response to Tina's concerns. So she'll talk about the death of her father, for example. I expect you to say that you're sorry to hear that, and how's she been doing. So I expect you not just to complete the tasks on the list, but also to appropriately respond to any losses, sadnesses, concerns that your client has as well. I expect you to close each encounter with a summary of what you found and what you'll be doing with the information you gathered. So in Tina's case, you say, well, thank you, Tina, for answering my questions. From what I have found here, it appears that your glucose is out of control, and I want to think about what medication may be the next best choice for you, and find out what you would like to do to better control your diabetes. I want to see you back in 1 week with diet history, and we can discuss this problem further. So just some kind of a conclusion needs to wrap up something or some component of your assessment. Each of the system-by-system exams have written work that are that include questions about the topic of the body system for that week. I want you to answer those with consideration of the unit topic as well. We have several units that we will be covering. One is on, for example, communication. One is on culture. So I would like you to consider any cultural or communication aspects in your system-by-system exam. This will help you prepare for the final exam, because if you think about these assignments just as separate items to check off your list, you will not really achieve the goals of this course. You are instead to try to integrate the various unit topics that we are discussing with the activities that you're doing. You need to plan to spend about 30 minutes with that section of ShadowHealth assignment, and that is done at the end of the virtual reality experience. And in addition, every one of these asks you to reflect on your performance. And so you're reflecting on what you did, but I also want you to reflect on what you can do next time. So the next time you perform that, what would be a goal for improvement, and so on. So we should see your reflections building upon each other and taking steps forward each time in your own learning. I know this is a journey. I do not expect this to be perfectly done, but I do expect that you'll continue to work and grow and improve throughout the course. The focus exams, which I said before, are considered summative. There's only one attempt, and you must identify the client's diagnosis. You'll document the data that supports your assessment and include a plan for the treatment. And this is done, so the documentation will be done using a SOAP note, and we'll talk about that in a minute. First of all, the focus exams are weighted more heavily than the system-by-system exams. The system-by-system and genomic exams end up counting about 1% each, whereas these are each 5%. So you need to recognize the different weights that these assignments have when you consider how to allocate your time in this course. The SOAP note, for those of you that may not be familiar with this kind of charting, I'm requesting you use this in this course because it helps me to see your kind of diagnostic reasoning. And for that reason, we will be using the SOAP note format. It does not mean that I do not recognize that in your work environment, you generally use checklists. However, that is the purpose for these here. S includes subjective data of the note. It's usually placed in quotations as far as what the person's concern is that alerted you to assess further. And it can also include aspects of the history. Remember, you weren't there to see the patient's history, and that's why that's considered subjective. The O part of the note includes the observations that you yourself gathered in the physical exam. It can also include lab values. So these are things that you actually observed with your eyes, felt with your hands, measured, listened to. Any of those are the observations that you place in the O section of the SOAP note. And the A is your assessment of the medical problem that the person has presented with. Then your P is your plan for treatment. Your Dane's textbook will help you determine a plan based on the diagnosis that you've identified through your health assessment. Another type of assignment in Shadow Health is the comprehensive exam. As I said before, this is the head-to-toe assessment, and it is a summative exam that you have one attempt to complete the entire process. And that assessment, it counts for 10% of your final grade. So you are learning how to operate with the system-by-system exams so that when you get to the comprehensive exam, you can successfully navigate, document, and record those experiences. The documentation piece and some components of the comprehensive exam are slightly different than the system-by-system exam. Do not let that throw you off your game, but I do recognize that some of those features are slightly different, and I do not want you to be surprised by it. So I wanted to let you know about that. In the physical exam, you place the activities in the order that you will perform them. Remember, this comprehensive physical exam is not done by body system, but done by body region. So we want to minimize both of your movements. There's one attempt, and your documentation is best accomplished as you go along and throughout the performance, and then you review it prior to submitting it. Thanks for listening. I hope you enjoy your time with Shadow Health.